I think it's a common scenario in all our clinics. If we prescribe glasses for even moderately myopic glasses for children, or every time the power goes up, there's absolute haywire. The parents often go absolutely ballistic. So, and I often joke that in the time that it takes me to counsel the parents, my cataract colleagues can definitely perform two phacos and enrich their bank account by a significant degree. But jokes apart, myopia is actually a serious issue, and it is time that we took time to try to combat this, because now we know that there are some lifestyle modifications and other modifications which can help to, if not completely halt the progression of myopia, at least to decelerate the progression of myopia. As we can see in this graph, it's expected, myopia is expected to go up quite a lot by 2050. And with it will the complications that are associated with high myopia, like retinal detachment and uh, degenerations, myopic degenerations. So it's time that we took time to talk to the parents. Now, regarding the advice that we give to the parents, it's basically reassurance. Parents sometimes, they think my child has a -1 at age 10. It's gone up to -2 at age 11 and -3 at age 12. So they do the math and think by the time the child is going to be 25, he'll have a -15. So we need to take time to reassure them and tell them that this is not going to happen. Also, because as I said, that the progress of myopia is to some degree modifiable, we need to tell them what they should do and what they should not do. The first thing that almost everyone asks is there anything we can do to stop the increase of myopia? If they had asked me, say, 10, 15 years ago, I would have said, sorry, there's just nothing we can do about it. But now we all know about the ATOM study, and we all know that atropine 0.01% does have a significant effect. Now, this ATOM study has been done to death, and I'm not going to go into that, and especially because Dr. Shukla is going to probably deal with it later. But I do use this graph to explain that using atropine will not stop the progression of myopia, but it will slow down the progress. And the problem with atropine is not that the parents don't start. The parents start it very well. The problem is compliance. What happens is we generally write, advise atropine and review 6 months. And then for some reason, now COVID, they don't come in 6 months. They come maybe a year later, maybe even a year and a half later. And they say that they have used atropine diligently for the first 6 months, and then they stop because we had said for 6 months. So I think it's important to explain to the parents that atropine goes on. If you can't come, the atropine continues. The other things we need to tell them to do is that they must have a yearly eye checkup. And of course, all children need to come immediately if they have an eye injury, but myopics even more so, myopic with peripheral degenerations even more so. And also we need to alert parents to the symptoms suggestive of a retinal detachment in myopic children, especially those with PRD or those with a family history of retinal detachment. The other thing, this we never had to say. In our childhood, parents had a lot of trouble bringing us back indoors. But now, getting the children to play outdoors is not common anymore. So we need to, and there are a number of studies that have shown that outdoor activity does delay the onset of myopia, and it does also diminish the rate of progress of myopia. So we must tell the children that, the parents mainly, that they need to encourage their children to play outdoors. During COVID, this is not so easy, but what they can do is maybe play on the veranda. We also have rooftops in India. They can go and play outside as much as possible. What not to do. There are not many things that I'll say you shouldn't do. One is, if you have a PRD, if you have a family history of detachment, go easy on the contact sports. There are lots of other things you can do. And this is the main problem. Again, studies have shown that increased dependence and increased use of digital devices is causing an increase in myopia. And the problem is that in COVID, we can't do without our digital devices. This conference is virtual. The children have to go to online schooling. But what we need to say is that apart from the amount that they have to do, maybe they should cut down on the recreational use of digital devices. Like I often have some mothers of babies who will come and say that they use the mobile while feeding the child, otherwise the child will not feed. So I think we should avoid that. And some studies have shown that while the pandemic will go, schools will reopen, this habit that the children have gone into of relying on their digital devices, this will take time, and we need to educate parents about that. So thank you very much for listening to me, and I'd also like to thank my assistant who has helped me prepare this presentation and stayed with me throughout.